Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jarvis S. Scott from What's Happening Birmingham. Today, I have the honor and pleasure of welcoming back Dr. Celeste Reese, board-certified physician here locally in the Birmingham area. Dr. Reese, thank you for coming back on again.
Thank you so much for having me, Jarvis. I really appreciate it.
Great. So I wanted to bring the doctor back on because the untimely death of Chadwick Boseman, as we refer to Black Panther, of colon cancer, to kind of talk about this disease and kind of get her thoughts on signs, symptoms, and when it's the best time to go get tested. So just kind of kick it off, Dr. Reese, what is the medical definition of colon cancer?
So colon cancer is cancer of the rectum and colon area. It can start at your rectum, but it can go all the way up into your bowel walls, into the mid part of your stomach, of your abdomen. And so it's a form of cancer or abnormally formed cells that kind of replicate themselves over and over to the point that they form a tumor.
Okay. Now with Mr. Boseman, he was typically in his, 40s, young 40s, when he got diagnosed. Is that typically normal?
Mm-hmm. No, that is not typically normal. The typical patient that has colon cancer typically is older, but we are seeing that trend in recent years that there are people in their 40s that are being diagnosed with cancer. And we're also finding that when we find these patients that are in their 40s that have cancer, it typically has progressed to a stage that's beyond the first one or two stages. So in other words, it's usually has progressed quite a ways. That is because people that are in their 30s and 40s, some of the signs and symptoms of colon cancer, because you're young, this is not one of the first things that you're thinking about. And if you wanted me to go over some of those signs and symptoms now, I can for you.
Yeah, go ahead.
Some of the signs and symptoms that people get with colon cancer includes a bowel movement that is not like normal. It may be a lot more narrow than it normally is. You may have several days of constipation or diarrhea that's normal for you, something that's different than your normal bowel movement. Some patients will complain of, oh, I have a movement. They'll complain that, oh, I have a bowel movement. And after they have the bowel movement, they'll still have that sensation like they still have to go. And so that also is a symptom of colon cancer for some patients. In addition to that, you can get bright red blood in your stool, but you also can get dark brown or black blood in the stool. You can get cramping or abdominal pain. You can also get weakness or fatigue. Sometimes that weakness and fatigue is a result of anemia, actually, because a lot of times when people have colon cancer, they can bleed into their colon, hence the bright blood, and then their blood cell count will be low.
Now, with, I guess, somebody you typically deal with, can you explain hemorrhoids and how sometimes that may differ than the colon cancer? Because sometimes people may have hemorrhoid problems and that makes them bleed typically sometimes.
Right. Hemorrhoids and colon cancer are actually two completely different disease processes. Hemorrhoids is inflammation of the veins of the rectal area, whether they're inside or outside. And so it's a growth, it's typically painful. You can bleed with it. You can get blood on top of the stool, typically. And with that, there's not a difference for a patient to say, oh, my stool looks like this. That means it's you have to see your doctor to make sure you can differentiate in between. But hemorrhoids is an inflammatory process. Colon cancer is cancer. It is a disease, and it is something that can kill you. Hemorrhoids typically can be treated with medication, but sometimes you have to have a surgical intervention.
Yeah, because I hear a lot of times people, if your hemorrhoids get to a certain part, get too big, that people get the procedure of cutting them. And what sometimes not want to go back to colon cancer. What's sometimes the dangers of sometimes if you go that surgical procedure of cutting the hemorrhoids?
You said what now?
If you say like if a lot of times if the hemorrhoids get too big, people may do a surgical procedure of removing them.
Correct.
What
Correct.
is what are some of the in your opinion the drawbacks to actually after getting that procedure done? Because I've heard some people say, well, if they have a bowel movement, they can't really hold it, whatever, go run because the hemorrhoid or that vein was kind of holding it up. In so many words.
Well, that that actually is an unusual situation. Most patients don't complain of that. So if they're having that kind of situation or the hemorrhoid has been that big, it may be that some of the musculature around the rectum has softened as a result of the surgical procedure or has been affected in that way. That would have to be evaluated on an individual basis. There's no generalized concept wherein most people that have their hemorrhoids removed have a sensation like they can't hold their bowels. Most patients don't have that.
Okay. So back to getting, if you see these symptoms, what should you do to far as like information about whether to go get tested or not? Is there cases where, like, I guess if there was family history, you can go to your primary physician and say, hey, I feel like I need to get tested?
Right, right. Right. So typically the screening for colon cancer starts at 45 years old for everyone for with average risk. If you have family history of colon cancer, your screening needs to start earlier. How soon your screening needs to start, I would tell you if you're 30 years old or older, and then start having your conversation with your physician to find out when do I need to be screened. It depends on what age your relative was, like the youngest age of a relative that had colon cancer. For some people, that means starting colonoscopies in their 30s. For some people, it may mean starting at 40 years old. The best thing that you can do is consult your physician to find out, hey, when do I need to get started my screening for colon cancer?
Okay, and one more thing I guess want to add since you got into the colonoscopy portion of it. Can you kind of explain what that process? Because a lot of people, especially men, we be so afraid of kind of going. I guess that's in addition to like the prostate about the actual process of the colonoscopy and things like that.
So with the colonoscopy, they're actually going to have you take or drink a prep 1 to 2 days prior to your procedure. That is to get your bowel kind of empty and get it ready for the procedure because they have to stick a tiny little tube that will be a scope that will look at your rectal area as well as other areas of your colon. So you have to take a prep before that. On the day of the procedure, they actually give you a little medicine that will kind of have you relax. You basically take a nap. When you wake up, the procedure is done. That's why you always have to have a driver. So typically, there is not any pain. There's not any pain that people have during the procedure typically, and not even afterwards typically. So it's nothing to be afraid of. They actually give you a little medicine to kind of, relax you, kind of like they do with when you have a surgical procedure, relax you for the procedure, remember anything from it. So it's nothing to be afraid of, and it's definitely something everyone needs to make sure that they find out when they need their first one.
Okay. Well, I don't want to hold you too long.
Okay.
I want to thank you for coming on, but any final thoughts you want to add? Like as somebody in this profession, when you hear it.
Other than, well, the only things that I would want to add is the things centered around prevention. Number 1, find out when it is that you need to be screened. Number 2, what is your family history? Find out, do I have family history of colon cancer? Your mom, your dad, your uncles, your cousins, everyone, family history. Thirdly, make sure that you keep on top of your weight. Obesity is a risk factor for colon cancer. Being physically active actually helps to decrease the risk of colon cancer. So exercise in here is important. Alcohol, stay with higher risk of colon cancer when you drink it in high amounts, and having a low vitamin D. So I would say pay attention to all of these things. Make sure that your diet is high in red meat. With red meat, whenever you have red meat or foods that you cook at a high temperature, there are compounds or little particles that are released that can cause the tissue of your colon to be kind of predisposed to having colon cancer. So eating a lot of red meat would predispose you to increased risk of colon cancer. So you want to make sure that you don't have a diet that's high in red meat. So those would be the things that I would encourage everyone to think of. I think it's a wonderful thing for us to do in honoring Chadwick Boseman and bringing awareness to this topic. So thank you so much, Jarvis, for doing that and helping to bring awareness to the general public about how important colon cancer is and how much we can honor this man that's been an inspiration to all of us over the last few years while battling colon cancer. He was inspiring and entertaining us, right? So in his death, I think it's important for us to, by, being more aware and having our family and friends be more aware of colon cancer and the things that we can do to prevent it. And that's all.
All right, well, thank you, Dr. Reese, for coming on. Always a pleasure. Good to see you again. I'll bring you back on.
Okay.
Something.
Hey, good to see you too.
Same here.
Okay.
Thank you all for watching this video. Like Dr. Reese say, if you please go get tested, everybody.
Okay.
That's the best way we can feel we can honor his memory. And thank you all for watching this video. Please check out what'shappenedbirmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank you all again, and have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.